Hi everyone, this is Dr. Rebecca here, and this is Instagram Live episode number 16. Today we have Dr. Alexandra Goodman on with us. We're going to be talking a little bit about Women in Residency Life, which is actually a group that she co-founded at Upstate Medical University, and a little bit about Dr. Goodman. She graduated from SUNY Upstate in June of 2021. She graduated with distinction in quality and patient safety for demonstrating consistent engagement with Quality Control Improvement Council at the institution. And she's just really well schooled and knowledgeable about all things residency. So I'm really excited to speak what the female experience is like in a residency program and just see what ideas she has for how we can do things going forward. Hi.
Hi.
So great to see you.
Good to see you too.
Everything good on your end?
Everything is good. Yes. This is the first time I'm doing this, so I was, making sure that I got connected to everything. I actually signed in with the Whirl account first, and then I realized I had to go back to mine. So
I like that. Yeah. It's definitely good to, get things checked out. This is new to most and to most people. So really great to have you. And so I'm really excited about our conversation. I was just kind of going through a little bit about your background. I think that you have so much experience being that, you are newly graduated from your residency program as well. And I just think that that is super impressive. I also love some of the things that you're passionate about. And a lot of the initiatives that you started as well. I think that women for years to come are going to benefit from all the efforts that you're making. So thank you for that.
Yeah.
Thank you for that.
Thank you for that.
Yeah, absolutely. So I did want to go through and ask you some questions, but why don't you tell us just a little bit about, why did you want to become a doctor? Like, what drove you to the medical profession in the first place? I know everyone has a story with that.
Yeah. So that's a good question. So, I definitely can't discount the fact that both of my parents are in the healthcare field. And so I grew up with that. My mother initially started off as a nurse, and then she went back, got her bachelor's degree, nurse practitioner. Then she went back, actually got her PhD. And so she kept up with the nurse practitioner's license and then also had the PhD. And so was able to kind of do psychotherapy with both of those licenses, with therapy and prescribing medications. And then my father, he's a hematologist oncologist. He's now retired. So I can't say that I didn't have any influence from them. But I will say, just ever since I was younger, my mom said, "You told me when you were 4 years old, Mom, I'm either going to be a doctor or I'm going to do people's nails." Those were two choices. So, I chose one pathway. I'm not sure why nails, but a 4-year-old Alex decided those were the two things. But, I've just always, really enjoyed working with other people and helping people. And I think that, growing up and seeing how much impact both my parents had on the community and with their patients, I really admired that. And, it just was always something that I really looked up to, and I really wanted to form those connections with other people and wanted to make sure that I could do what I knew I could do to help other people. And I felt really comfortable in that setting. So, honestly, there was never really a time where, I really have to force myself to think about what would I do if I wasn't a doctor, because that was just always kind of how I saw what I saw myself doing. So that's pretty much, kind of how I decided to become a doctor. So.
Yeah. And well, it's interesting what you said too. So much, I'd say that healthcare certainly has changed, right? As it should over decades of practice, but it's so much more community and interdisciplinary than it ever has been, possibly. Just speaking from my own opinion here, totally just my opinion.
Yeah.
But it seems like your perspective just lends itself so well to a community approach. And to benefit the community, so all those elements together. Great. I think that, so founding Whirl, and we're going to talk about Whirl a little bit, and then there's so much in that as well. You just finished up a drive, right, for feminine hygiene products as well.
Yeah. And actually,
Like,
because she and I just like counted all of the like the actual physical products that we got, and just finished like kind of calculating all of the money and stuff too.
mhm.
So it was kind of exciting to see how that's grown as well. So.
That's great. What do you have any numbers that you could tell us about, like
Yeah.
involvement or just?
So when we did it back in 2019, we collected greater than 10,000 products. That was like once we had used our monetary donations plus our
Mhm,
physical donations. This
mhm.
time, just the physical donations alone, we just counted were a little over 6,000, and then we have
Wow.
another about almost a little over 2,400 in monetary
Wow.
donations, which will probably be at least another 10 to 15,000. So we're estimating that overall we're going to get over 20,000 like individual products that we're going to be able to kind of like distribute throughout Syracuse.
That's great. So
Yeah.
yeah, are they distributed to? Because I know, I mean, the medical university, that's all also another thing. Because
Yeah.
students, I think that's often sometimes people think, someone's going into medicine, they probably have a lot of money.
Right. That's
They're
not
like
the case.
they're
Yeah.
they're still students.
Yeah,
So,
exactly.
funds are limited, but and I know that because I also went to Upstate, that there would sometimes be feminine hygiene products in the bathrooms, which I
Yeah.
always appreciated, right?
Yeah.
But of course, there's other populations that can benefit as well from it.
Yeah.
So it sounds like these are going to be distributed throughout the whole Syracuse community.
Yeah. So we actually last time, and we're gonna plan to do the same thing this time, is we're gonna probably distribute them to like 5 or 6 different places. One of them being the Vera House, which is a safe haven for people who go through domestic abuse, and allows them to have a safe space where they can go to. So that's
Mhm.
gonna be one spot. There's also La Liga. It's the Spanish Action League here in Syracuse. It's actually one of the poorest countries on the East Coast, which is pretty interesting. Poorest Spanish communities on the East Coast,
Mhm.
and they do a lot within the community. Also, the Samaritan Center. I think a lot of people are aware of that. They do a lot of food and
Yeah.
clothing, and giveaways for the homeless within our community. We also we're giving back to like our own clinic, like UHCC,
Mhm.
our upstate hospital continuity clinic. We were working with our patients every day, and we see that there is just this huge gap, and particularly with patients who don't make a lot of money. I mean, like there's I think the number was like 2/3 or like as much as 60% of people have to kind of determine like, oh, are they going to pay for their meds? Are they going to pay for hygiene products? Are they going to pay for food? And it's like on top of that, it's just one more thing that they have to pay for. And so we've in the past given to our own UHCC clinic. And then also we're, like you said, like even just our residents and medical students, it's interesting that you brought that up, because there's this whole kind of thing going around that medical students are really struggling actually, because they don't have money, and like they're taking out loans to pay for medical school, which is extremely expensive, and not everybody comes from a lot of money. So like how are they, they're struggling even to buy food and all of that. And so
Right.
we know that as residents and as medical students, like yes, one day we will make money, but while you're training, you really don't make much at all.
Yeah.
And then just even running around the hospital and being so busy, we want to have like some available. Like every woman has been like stuck in that spot. Like I was just telling my friend, she was like, "Oh my God, I left the house. I didn't get a tampon. Like, what am I going to do?" So we like to have that, accessibility for them to make just, one thing easier can make a difference, right?
Absolutely. And then, just being the financial component, I'm sure that with everything going on in the world, maybe there are grants or scholarships or things that are not necessarily going to be available
Mm-hmm.
right now. So whereas
Exactly.
those, there might have been funding, maybe there's less funding
Exactly.
than there was. And
Mm-hmm.
then of course, there's loans. I know all about student loans too.
Yeah.
um, but speaking to what you were describing, some of that experience of a woman in residency life, experiencing
Yeah.
medical residency, you founded Whirl, you
Yeah.
co-founded Whirl
Mm-hmm. Yeah.
with Kashia.
Mm-hmm. Yeah. Because she is.
So why did you? I mean, these are questions that I am not questioning that it's needed. I'm just
Yeah.
wondering. I'm prompting. So like, why did you think that you should,
Was needed.
start something like
Yeah.
Whirl?
So yeah, I guess for those who have joined and don't know what Whirl is, Whirl, WIRL stands for Women in Residency Life. And we it really started off like she and I was having conversations about how like our experiences were much different than our male counterparts, and in many different ways, just about like how we deal with situations within a work setting and how our interactions are different, and also just like the daily struggles that women overall, not just women in medicine, but like when and who and how do you start a family and also have a career? Like, how do you balance that? And like, if you are somebody who really wants to achieve a lot in your career, like how do you balance that? And like, what are the resources? Because sometimes I think it's just not as innate in women to like really go after what they want, or like, ask for that salary or ask for that promotion. It's not as natural to us. And I think that we thought that this would be like a really great way to like provide support for residents. Because, we looked, and I was part of American Medical Women's Association in medical school. And here they also had a Women in Medicine and Science, which was more for like faculty. But we were like, there's nothing for residents. And, we actually looked into seeing if American Medical Women's Association, they could create like a residency chapter, which they did have that opportunity. However, you had to like fill out all this paperwork. You had like every member has to pay a certain amount of dues. You had to go to a certain amount of events. And we were like, residents aren't going to want to do this. So we were like, what is something we could do that's like low cost, like low amount of time where people can commit and feel like, they are actually doing what they want to do and not feeling like it's forced or obligated. And so we were like, maybe we should just create our own group. And ultimately, like our group we want to support like women professional development and like advancing their careers. And, overall, I think the best way to explain it is we want to do that through like 4 main branches, and like through mentoring and networking, professional and personal development, community service, and then also just like general wellness. Because we knew that like there were all these kind of ways that we felt like we could help. And we did that amongst our own friends that we had made within residency, and we wanted to be able to share that and with that camaraderie and support, and also make it more accessible for people to connect and network, like particularly when it's a little bit challenging during COVID time too. So
yeah. I mean, even the mentoring piece as well. I think that sometimes, in different professions, and certainly in healthcare, I mean, there's a little bit of it in PT. Certainly it's almost like it's going to be too harsh of a term, but like eating their young. Like the people who have had more seniority have been, kind of like through some of the difficult times, just look at the new folks and say like, you've got to go through what I went through type thing.
Exactly.
I think that, but whereas the opposite is just so much more, we know is just a lot healthier and better for overall well-being and better for performance, accuracy. And especially right now with COVID, it's healthcare looks a lot different, right? So it's almost like it's prompting us to look at things in a different way, to do things in a different way. So I just feel like World just fits in perfectly with all that. It really it serves a need, and then now like more than ever maybe.
Yeah, absolutely. Yeah.
So is this something that you mentioned that you're going to be speaking in February? Is that right?
Yeah. So there's the New York American College of Physicians. It's basically just kind of like a national group. And there's like a New York State chapter, and we've been connected with them because both Kashia and I serve on the residency fellow committee. And we did a first talk back in 2019, basically like who we were and what we had done so far, which really wasn't, and what we planned on doing. And it's interesting because we just recently looked back at that, and we looked at all the things we wanted to do and realized we had accomplished pretty much all those. And we were like, wow, like that was a lot of stuff we did, but also cool to see like kind of how far we had come. And so we're going to be speaking again, sort of catching up on like what else have we done, but also like for anybody else who feels like this sort of group. And again, this, like, we're applying this to residency, but this really can be applied to any type of setting. And you can give it your own name. We call it Women in Residency Life because we felt like we really want to gear this towards residents. But like our basic concepts of like mentoring and community service and wellness and just personal and professional development, I mean, it can really be applied to anything. And so this webinar is really going to be about like, how can you do that? And, I think I did share with you, and maybe they can get a hold of, we do have a publication basically on like 12 steps on how you can create your own women's support group if that's something that you want to do. And, Kashi and I have done this with Allegheny in Pennsylvania, and we basically took everything that we created and we passed off to them because we said, listen, we did all this work already, and we want you to kind of have this like head start, like with this that we created, and they were able to do the same thing, and they've had a great success. So that's been really nice to see.
That's I know that as a PT that something like that would be super helpful. Especially because it's not so like, and we've spoken about this too, and if anyone's tuning in who's not in PT, but it's not so structured. So like you graduate with the clinical doctorate and then you're just out there. So it's like undergraduate coursework and then graduate coursework, and then there's nothing structured. So residency life, it's almost like, it's yes, it's structured, but it's still sort of like school. So it's still very stressful. True. And then, so someone's watching you and evaluating you and that type of thing. But it is very interesting just thinking of some of the benefits of first few years of practice. So, some of the things that you've touched on, just thinking of PTs who are fresh out of school, if there's not adequate mentorship, or depending on wherever they're working, or even if they're working in a place like where I work in a large organization, there is mentorship. So there's, people around, but there's nothing that's specifically guided toward wellness in particular either. Right. So even just the 4 components is great. So if anyone does want, Dr. Goodman and Alex, you mentioned the publication. So there is a link if anyone, I would say do it after this, right? So we can follow the conversation here. But afterward in my bio, you'll find a link, and just search for blogs, and it's the latest blog. So when you see the blog, you'll see Alex's beautiful face. It's right there. But there's some information on there, and there's a link to the publication. So if anyone has any questions or can't get to it, let me know. But there's that information there. So that's awesome. That's really, really great. And I do hope that more people start something like that, because Upstate's just really lucky to have it. Do you find that all the residency programs, you make it available to all the different types that are at Upstate?
Yeah, so I'm in internal medicine, and so primarily that's like who we have easily been able to kind of get access to. However, that was another huge thing that Kashi and I found important, was we really wanted to make sure that it was to all the residents. So we've done our best to reach out to surgery, urology, obstetrics, gynecology, emergency medicine, physical medicine, and rehabilitation. We actually just recently passed the torch on. So Kashi and I are now part of the board of trustees, and there is a new board of members that was elective, and the president is a physical medicine and rehabilitation resident, and then others are medicine, but then we have a surgery resident who is one of our board members as well, and then also an emergency medicine who is kind of like our liaison between our connection between emergency medicine department and our board as well. So it's been really, really nice. We've been able to kind of connect with other specialties, and because we would find ourselves working with these people every day, and sometimes it's under really stressful situations. So it's my patient, this is what's going on with them. I feel like that, surgery needs to come and check them out. And, a lot of times, we forget that these are people that we're talking to, and to form those relationships. And so we felt that was really important, because these are, you see them walking in the hallway, you talk to them on the phone, and we wanted them to know that just because you're in a different specialty, we do have similar struggles being women in medicine, and particularly for something like surgery where the percentage is so low. We wanted this to be a source of support and camaraderie for them.
Yeah, that's great. And it's good also that that through the institution that you're able to have connections with other residents as well. If there's email lists or anything like that, where you can, and you don't have to know who's who or find a roster or anything like that. But that's good that you're all connected. So so tell us a little bit about how did you do in residency?
Yeah. So residency, I would say like Upstate is like a really, really great program. I think most people, they come out of it and they feel like they really can handle a lot. With the patient load is like pretty large, and you know, you have a lot of support, and there's always people in the hospital that you can go to, and resources, and, you know, ancillary staff, and everybody, you know, has to really work together. And I think particularly during, you know, COVID, it was really stressful. You know, there was nobody, you know, it was interesting in one aspect because essentially everybody was at the same level. Like nobody knew more than the attending didn't necessarily know more than me because nobody knew anything about the disease. So when COVID first started, you know, that was really tough. And actually, when we started Whirl, it was at the beginning of my second year, and then it was midway through my second year. That's when COVID started. And, you know, I think that we had some setbacks in terms of particular events or things that we did with Whirl during COVID. But I think generally the events that we were able to do, you know, we really found valuable because especially during this time when everybody was just so isolated, and, you know, everybody was just, it was a very scary time, you know, especially being a resident, you know, you didn't want to go near family, you didn't want to go near friends, and like you'd have to come back to your apartment and make sure you just like cleaned everything, and, you know, didn't touch anything and didn't breathe near people. And so it was you know, it's, you know, interesting, but, you know, I think that we all, you know, got through it. And, you know, it was definitely some challenging times in there in the ICU. But, you know, I think that, you know, the important thing is like everybody still tried to work together as much as possible. And I think the harder part now is that specifically at Upstate, and I think it's, you know, across the country, is that you're having shortages with nursing and physicians now. And so that's just making, everybody's just getting stretched very thin at the moment. So that's just making things more difficult. But, you know, I think everybody's doing the best that they can under these circumstances.
Yeah, and there's still, you know, there's still the birth of this wonderful of this wonderful group. So yeah. So I mean, you know, I try to look for that shiny part sometimes, you know. So I mean, with we were able to do that Zoom mindfulness.
Yeah, that was so nice
as well. Which was so great. That was that last year or the year before? I honestly.
Yeah, I think it was last year. Yeah, when we did a gratitude month, and so you know that we really enjoyed having you on there and being able to do that. That was like part of our wellness part. So it was really great to have people to get together and try to, you know, even just if it was for 30 seconds, try to just, you know, just pause and
absolutely and you know, certainly working, I think something like mindfulness, breathing technique, those are more important than ever, practicing in healthcare and definitely in medicine as well. As you said, you know, it's such an unprecedented time, with, I can't even imagine, you know, I know that as a PT, you know, while I'm working in a hospital setting, I know that ultimately, you know, I won't need to break the news to a patient that, you know, something really severe is going on. So thank you for what you do and showing up every day. So what are you most excited about the world has done overall? I know you've accomplished a lot of different things and touched a lot of different residents. And now you passed the torch, as you said, which is super exciting, because I imagine maybe we were like, what's going to happen now?
Yeah, we did have some, you know, worries there that especially during COVID, we weren't sure could this be sustained. And you know, we really tried to be creative and find different ways to kind of connect with the Upstate community and with our board members and our general members. But I think like the biggest thing that I've really liked with Whirl and proud about is just really just like maintaining those like connections with people, particularly during, you know, residency, it's just very stressful environment for everybody. And then on top of that, just being able to create those like leadership positions, like, you know, we were finding, you know, you enter into residency and, you know, you're basically just training after training after training. And then you're expected to like be an attending and, you know, lead all these people. And it's like, well, I haven't done anything in leadership. Like, I don't really know what that means. Like, can I even be a leader? And so we wanted to be able to provide that for residents so that they had the option, okay, like let me try out a leadership position and see how that is while I'm in residency, kind of a little bit earlier on than maybe you would be allotted in a normal setting. And so I think that was really important. And then we've really loved just connecting with the community. Like our community service has been like really kind of like eye-opening for us. Like it's enabled us to like learn more about like the types of patients that we work with on a day-to-day basis, kind of like where they live, where they come from. We've done like 2 hygiene drives now. We've done like a coat drive where we raised like over 250 coats. We actually were able to do like a blood donation during COVID when convalescent plasma was running low, and through that, I think we got like 45 donations, which ended up being able to be given to like 134 patients, which was really great. And then we did like a coat drive, and we did a toiletry drive, and we did a feminine hygiene drive, and we did a virtual 5K too. And I think we wouldn't have been able to do it without the support of our board, and we have had some really great board members who have been really motivated to also do stuff within the community. And so we kind of have just all worked together and tried to say, okay, like what are the needs of the community, and like can we make it simple for residents, because we know they don't have a lot of money, we know they don't have a lot of time, but like still allow them to feel like, okay, I'm connecting with the community and I'm doing something for them, and it makes you feel a little, it's part of your wellness, but at the same time you're being able to give back and understand that community that we're taking care of. I think it's really important.
Absolutely. Well, and I would imagine too, just because of the limited number of medical schools that there are nationally, internationally, that many medical students are not necessarily from this community or from around here. So, I mean, even that, just getting to know who lives in Syracuse and some of those, because of course, upstate serves many who are in those lower socioeconomic statuses. But so so working with the Vera House, have you done any specific work with them other than you mentioned the hygiene drive?
Yeah, so they actually have a lot, like a very like extensive list on things that they actually need for donations. So we've done a lot of focus on that just because of timing and residency. Like our timing was just so limited. So we're never able to do any active volunteering at Vera House, but we did those donations. The people that we really did connect with was La Liga, that's Spanish Action League, which before COVID started, we tried to do workshops with the youth group there. They had a youth group that met would go after school like every day, and a lot of them came from really tough backgrounds, like they saw their parent get shot in front of them, or they were immigrated and they're still learning English, or they're living with their grandparents because their parents are still stuck in another country, and just so many different scenarios, and it's so challenging, and we wanted to kind of see if there was some way we could give them some ideas and hopes and kind of confidence to say, okay, like let's think about your futures, like so many of you need support, but like how can we offer you guys mentorship in a way, and see like what are your guys' ideas of what you want to do in the future. So we did things like and every time it was like a few different people from our member list, and we choose like 2 people, and some of them were like on like body positivity, how to like create your own like CV or write a personal statement. They did like vision boards. Another one we did was like just like a career in medicine. We were only able to probably do they were all really great, and I think like the kids really loved them. I think we probably were only able to do like a handful of them before COVID started, and we had to put that on pause, but we're really actually looking to reconnect with them. And I think the current board is going to try to reconnect with them and start those workshops up again, because we felt like that was really valuable. And as we, because she and I would always talk about how we would go and we were so tired, we'd come back from the ICU or from long call, and we'd go and we'd hang out with these kids, and they just had all these like thoughts and ideas, and despite their backgrounds and where they came from, and for us it was just such like it grounds you, and makes you realize how lucky we really are, despite these difficult times. And I think that was something that really just kept us going.
That's amazing. You both of you are rock stars, seriously, to be to be
Yeah.
full-time resident, and then also to make time for
Yeah.
all these other things, these wonderful things.
Yeah.
I remember when I was a student, I don't know, I think that Upstate also has some maybe literacy things at Southwest Community Center.
Mm-hmm.
If you ever heard about that at all.
No.
At the Southwest Community Center, so there's a group called CHAMP. It was an acronym. Basically every Friday, PT students would go and we would lead the kids ages like 5 to 12 through agility drills and sports games and things like that, because in a lot of the city schools, recess has been cut at this point, or at least, every other day or something like that. So understanding that physical activity can spur and assist with cognitive function. So, and that I can relate in some ways to your experience, to where, showing up there and just seeing that, these kids were still showing up and they were still bringing their all, and they had a lot of other things going on. It was extremely humbling, I think, even just to see, some of the equipment and things like that. So we were able to get them some equipment that they use, like yoga mats, blocks and things like that, through a grant. But nothing like that with La Liga, you said, is the group that you do.
Yeah.
So really fantastic. Yeah. So currently, you have a lot of different titles and roles and hats that you wear. You are the Chief Resident of Quality and Patient Safety for the Department of Internal Medicine.
Yeah.
Yeah. Wow. And you work full time also in the ICU, the medical ICU.
So right now, I'm actually just doing this as an extra year for me to just be the chief resident. So I primarily am the chief resident for quality and patient safety. So I don't have any current patient requirements. But starting in July, I'm starting hematology oncology fellowship. So starting then, it's starting a new training session.
Yep, you were just accepted, right?
Yeah. So, yeah, thank you so much. Yeah. So honestly, right now, I've been kind of missing seeing patients, but I've been seeing this other side of medicine that is also very real, and it's been interesting to kind of work a little bit higher up in academia and with the other ancillary staff, and kind of see the that they're outside of just the normal stresses of like, let's take care of the patient and make sure the patient's okay. Well, there's all these other things that go into like how the hospital runs and how things can be done in a smooth fashion so that, people are taken care of well. And that takes a lot. It's a lot of coordination and a lot of communication. And, I think that, when everybody's, scared during COVID times and stretched so thin, those are times when those areas start to break down. And so that's kind of been my job this year, is kind of really connecting our current residents who are the ones who are really the backbone and workhorse of the hospital right now for medicine. And especially during this time of COVID, they're in the ICUs and on the floors, which is, what I did during residency as well. And how can I help them to connect with other ancillary staff or other things that are going on in the hospital that can kind of hopefully make their lives a little bit easier, despite, there being so many variables in the mix of it all.
So does Whirl have a website?
We do have a website. It's a little slightly outdated, so I will give you the link to that.
Do you want me to pin it here?
Yeah, you can. Yeah, you can. Okay. I don't have the link with me right this second. Maybe if Kachi is on, she can add it into the chat. But yeah, we do have a website, and it's pretty much up to date. There's just a few things that need to be updated that we're going to work on. Our Instagram is probably the most up to date. Like, it has all of our events and what we've done and what we're currently doing. But I will give you that as well, so you can kind of attach it to all of the information from today as well.
Okay. Yeah, I'll see how I can do that.
Yeah.
What's the handle for the Instagram?
Upstate_Whirl.
Okay. I thought so. I had that, and then I changed it because I wasn't sure.
I can see if I can get the website.
I'll put that. I don't know if it doesn't hyperlink though.
It doesn't?
Yeah, but if anyone wants, I guess you can use a pen and paper and write down.
Yeah, and I can. Do you want me to put it in?
Sure. Yeah, if you have the website.
should I put it in?
Yeah, you can put it there. And then anyone who's on who wants to, yeah, like, oh, thank you, because she has got us. I don't know if I'm frozen or, okay, gotcha, you're back.
No, sorry, that was me. I was getting the link so I could put it in. Oh, and she did it.
Oh, yes, that completely makes sense. I know. Then sometimes people get a phone call on these things too, and then like you kind of like you can't be on like do not disturb because it's like using so it's confusing.
Yeah. But so that's our website. It still needs some updating, but it gets you the basic information, and otherwise like our Instagram is really what we keep mostly up to date. We do have a Twitter as well, and we also have a Facebook. Our Facebook and our Twitter, kind of like whatever we post to one kind of gets automatically posted to the other. So, we try to keep them as consistent as possible, and we try to see, what different populations we can kind of reach out to depending on what the social media platform is. But I was actually thinking, what you said about physical therapy earlier and how like there are people ahead of you that say this is how we did it and how it needs to be done. And it made me think, I think that there's kind of like this evolution going on within the medicine culture. Like my father was in medicine in the 1970s, and I always joke with him, I'm like, Dad, for your exams, the only thing you need to know is penicillin. That was the only medication I had. Your exams couldn't have been that hard, But so, since he's kind of been in medicine, I've heard a lot about how things used to be, and there's a lot of things that really haven't changed, but like a big thing is that just the amount of work hours and the there was no focus on like what wellness, and so I think that as a culture, like I feel that residents are trying to make that change, but it's just so embedded within the culture of medicine that it's very hard. And so that was a huge reason why I pursued mindfulness-based stress reduction, and why I still try to do it at times, and why I connected with you in terms of yoga. But I think that it's really important, and just everybody talks about like as physicians we need to like advocate for the patient, and we need to advocate for the people that we work, but you also need to advocate for yourself, right?
Yes.
Because especially at a time like this, I know that like my friends and I, there's been times where you just feel like you've run yourself into the ground because you're just keep trying, but then you don't take a step back and say, okay, like what do I need to do for myself? And so, we try to do a little bit of focus on that as well within Whirl as well, and reminding people, these are things that you still need to do to keep your cup full so that you can
absolutely. It's very much about the long game, right? Yeah. So it's like right. That's the interesting part, not only about COVID, but a career, right? Yeah. So, I mean, you could think about the short term and things that you want to accomplish and how things go. But at the same time, you also have to think about longevity. So I think I think that's just so wise. Exactly. And I wonder, my parents are retired. They were both in healthcare. My father was a hospital administrator. My mom was a pharmacist, but they both started as pharmacists. Interestingly enough, we, my sisters and I didn't look at them and say, we want to do what you did, the way that you had that experience. But none of us are pharmacists. But anyway, my parents have said many times that like in healthcare, it really was, they didn't talk about burnout like as a term, but it was to the point where, you would have people who worked for decades and then they would retire, and maybe this is for many reasons, but they oftentimes would live very long after retirement. Was it because they were working, it could, of course, there are many reasons that could have been due to, but part of it maybe because they, worked themselves in a way that wasn't sustainable. Yeah. So of course that's after a career, right? Then we think of like people that have a good few years that, that they're working super hard, and then they just sort of like mentally check out, and they're just like, well, I used to be really compassionate and I would care about every patient, but like, I just have to create this boundary every patient I work with now, because every time I connect with them, it's so much energy for me and I don't have anything left for myself. Right. So like what you were saying about filling up your own cup, like in order to be able to do that, in order to be able to deliver compassionate care, like if that's a goal for someone, right? I think that it should be, it ought to be at least something that people consider. But if that is the direction that medicine and healthcare is moving toward, definitely focusing on the self has to be a part of it. And I think that, like you said, in kind of like an archaic, old school mentality, looking at yourself and thinking about yourself was so like faux pas, not like, what you did. Yeah. You got to think about the other person. But you know, I know in my life personally, I don't know if you know anyone in your life, but people who have really just like burned themselves out. You know, they just work so hard, they forget to eat. They, you know, don't sleep, you know, don't exercise or move their bodies and things like that. Say yes all the time.
Yeah, I mean, that's me. That's me. I mean, I did that in residency. Like, I was like, you know, when I was on really tough rotations, like I was like probably not eating the way I should have, and I was like losing weight, and I was on like 4 or 5 hours of sleep, and you know, I was always saying yes, and like it came to a point where I was like, I need to be able to like set these boundaries here, because I, as much as I really love doing all this stuff and you know, find value in it, like I need to remember, like I need to just take a step back and take care of myself, because you know, I was reaching my limit. And it feels really, you know, not good when you get to that point. And then that's why I have to keep reminding myself, and kind of why like I got involved in mindfulness-based stress reduction from the beginning, because I knew, you know, doing medicine, like I just heard my dad said, you know, listen, like it's, you know, a very long journey, it's tough, you know, and so if you don't have the right tools to kind of be able to cope with that and have like the support system, or have people that you can talk to or go to, and be able to have ways to, you know, minimize your stress, whether that's like exercising or meditating, or, you know, doing some mindfulness activities or doing yoga, like then it's really, really hard. And I think that, you know, even me as somebody who has those tools, like I struggle to find the balance of where and when to use them. And it's not easy, you know?
Yeah, I mean, there is a lot too to be said. And you know, I have to say, so like I'm newly postpartum, so like I have a baby who's 5 months old, but still, like I find that it's challenging for me to carve out time for myself, even though I know that it's gonna be like so helpful, right? So it's like, of course, with a baby it might be a little bit different, but at the same time, right, you still are thinking of like this other person, they need me, like thank you. They're so focused on this other person, right? As many of us are focused on the patient. What does the patient need? You know, forgetting to eat. I can totally relate to that. I did that all the time especially when I worked in the hospital, actually. Working in outpatient ambulatory setting, it's a little bit different, but in the hospital, it's like, you're just nonstop. For the whole time that you're there. But you mentioned something really interesting too, all the way at the beginning of the conversation, when you were talking about advancement for females, advancement for women. And I just think that that's we could have a whole other conversation about that too. But I think that I'm so happy that Whirl is out there, right? I can't express that enough. And I wish that every profession would have something like that. Just because having more opportunities and mentorship, I think mentorship is so key. I have a couple of really, really good mentors who are also females in the PT profession. And like, I don't know what I would do without them, because if I ask them a question, like, what do you think about this opportunity or that? But I've been told many times that, like, you know, and this is like, nothing against like male counterparts, but that you know, someone who is a man will like maybe go for an opportunity even if they don't have the qualifications sooner than like a woman would wait like until she has the qualifications for like 5 years before she'll you know, even attempt. So I think that if we look at it like from both roads, right, like yes, we're saying yes to everything, but it's because it's kind of like, if you don't, then you know, you never feel like you're ready to take the next step. So I think that, you know, and I wonder, you know, how the mentorship that Whirl offers kind of like knits into that. And it's could potentially be really helpful.
And I mean, it's interesting that about the male female dynamic, because like they've actually done studies that, you know, they have all like males and females do like the same exam, and then they say, take a guess on like how you did on that exam. Like males would always guess higher than they actually did, and females would always guess below than they did. And it's just like that is just like how it is. Like females are just exactly how they want to have, like feel more prepared and feel like they have like a little bit more background and experience before they apply for a job. Whereas like men just are more innately feel like, okay, yeah, I'm going to take that on, and I'm going to just do it and try it and, figure it out. And, I think that females are a little bit more hesitant in that way. And so by creating Whirl, we wanted to be like, hey, like, these are the opportunities you have, like, you can do it. Like, we're offering the support. So not only are we acting as mentors to like residents who are coming after us and whoever is part of the incoming board and whatnot, but also, we're starting even to reach out to medical students as well, because those medical students then become residents. But then also, like, we've been connected with this whole network of like women within our institution who are just amazing. Like, they just have so much experience, and they have had their own battles trying to make it in this career that's, very in the past, not currently, but in the past has been predominantly males, and how that is, and like, how do they determine, oh, am I going to take this leadership position, or do I worry about, am I going to have another child, and how is that going to work, and how am I going to kind of cope with that? And so we've kind of tried to make this kind of flowing tier mentorship, thing, because that was like a major thing that we saw when we did research, was like, why are women not doing more leadership positions? Because they don't have the mentorship for that. And the interesting thing is what we also found was, it doesn't have to be a female mentor. Like, my mentor currently right now is a male, and he's been great. Like, as long as you have somebody, like, mentorship is a very strange thing. Like, you need to be able to connect in a way that you make, motivate each other so that you can work together and make things happen, and also learn from that person. And so it's like a very interesting relationship, and it's not something that you can force, but at least by having those opportunities, hopefully it gives you more chances by meeting more different people, that you can find somebody that you can connect with on that level.
Absolutely.
Yeah,
absolutely. That's just such a great point there. I know that I've also read that when people choose their mentors, that like, that's rather than having them be assigned or anything like that. I think when you're in a program, they assign you an advisor, that type of thing. But it actually serves you more if you self-select a mentor.
Yeah.
So that's also something that people can keep in mind. So you handed off, right? You're on board of trustees, but handed off the reins to this new board.
Yeah.
Congratulations to you and Kashia on that. And now you're gonna be starting this fellowship, right? So I don't know if there's I don't know if you recognize a lot of the handles or things, if these are like people that but like, do you want people to keep in touch with you? Do you want to share your information? So if anyone has questions about Whirl or anything like that, I guess if anyone wants, you can message me, or you could, if you want to share your email or anything like that, any information, then they could reach out to you if they have any specific questions they want to follow up with you for.
Welcome.
I think you might be like one of maybe two people who I've interviewed or just had a conversation with who doesn't like have their own business. So sometimes I'll say like, how can people follow up with you or make an appointment? But this is a little bit of a different situation, right? You work for a large organization.
We do have a Whirl email account. So I do.
Okay.
We should make business cards. Maybe that's our next step.
Yes, that would be really good. The website I'm excited to check out. I really am. And I've seen a lot of your other information online, and definitely follow them on social media, on Instagram. They've got a lot of good stuff on there. So I'm excited to see what they do next. I'm excited to see what you do next. Congratulations on the fellowship.
Thank you so much.
So exciting.
A podcast is in the kind of brainstorming works.
That's great.
We'll see.
I can see it.
Because she is starting gastroenterology fellowship. So, and I'm starting HEMONC fellowship. So we're both going to be pretty busy, but we're gonna see if we can make it work. I just appreciate you having me on here. I think that I am just like 1/1000th of like just an experience. Like, I think I saw that one of my really good friends just logged in. She's a plastic surgery in New York, and she is one of two females within her specific group. And so, she would be another great brain to pick, because she has a lot of great stories and experiences, and definitely during COVID as well. So, the experiences that I talk about are really just like 1/10 of like what women have, but that's why we created Whirl. We wanted people to be able to have a platform where they could talk about that and feel comfortable and kind of either celebrate or commiserate regarding different, experiences that they have, and make it feel like they are not alone.
Absolutely. Absolutely. You're like inspiring me to maybe, do something with a group of PTs, female
Yeah, you
PTs.
should.
But although PT is like predominantly female, so that's, although it, we still run into the same things, and, it's very interesting. Being, I don't know what, my brain is like a little foggy lately with the lack of sleep, but patriarchy, that's the patriarchy. So like, not to bring that in, right? But like, women can be a part of the patriarchy.
Yeah.
Right. So like, I like women in PT. Yeah.
Yeah.
That's whipped.
Yeah, whip. I like that name.
That's kind of awesome. But yeah, just because we all may know individuals like that, and it's not that they're doing anything that they, intentionally think is, potentially like aggressive or harmful, but that could still, women can still be a part of the patriarchy.
Yeah.
And I don't mean to like put it in quotes. I know it is a real thing. I believe in it, but I just know it's like a hot topic. So, just erring on sort of like the borderline. But I feel like, even in a profession that's mostly females, there's still like kind of a little bit of like male aggression that's there, very, very prevalent.
Yeah, exactly. It's really hard to kind of like navigate that.
Yeah. So thank you so much for taking time and
thank you.
all of this. It was really great. We'll have to do it again, maybe before you start your fellowship. Thank you for sharing all this information. So again, just to kind of recap, if anyone wants the information regarding that article on how to start your own residency, Women in Residency Life, you can go to the link in my bio and then go to blogs. You can also DM myself or Alex, and you can also go to follow Whirl. I would definitely follow Whirl. And right now, oh my gosh, you'll never guess. Hold on, I'm gonna have to screenshot this right now. Oh wait, hold on. Oh, there it's back. Someone hearted. They put, this is awesome, Alex B. Fahim. So that, and the heart was like right here. It was just really cool. I screenshot. I'll send it to you.
Like on my head?
Yes. Yeah,
so
it was
funny.
just like right here. It looked like a bindi dot actually, but it was just a little heart. It was really cute. So.
Well, it was my love, and thank you for having. This was like really fun, and it's like a really great way for us to kind of think about, like, we're so focused on how can we help residents, but this is something, like I said, that can really be, really implemented any type of setting. So it's really nice to kind of like be able to share that and see who other people who are inspired by it, and maybe they want to do their own thing.
Absolutely. And thank you for talking also, because it's like people in my network too, so healthcare, we know it's very widespread, and medical community is a part of it. I think sometimes they're siloed off. It doesn't have to be that way, so I love talking to you, so it's awesome.
Thanks. It was really nice to talk to you, and maybe we'll have to do another like yoga mindfulness session at some point too. That'll be fun.
Yes. I'd love, maybe you can lead us in meditation next time.
Okay. Maybe I'll try.
All right, I'm gonna sign off. And so great talking. This will be available if anyone wants to go back and listen to some of it. Have an awesome night.
Okay, thank you.
Bye.
Bye.